Webinar's now live. So welcome everyone. We're just giving you a chance to all join us before we make a start. Yeah, I can see the numbers ticking up as more people join. So let's give it another minute or so before we make a start. Right, so the numbers have stopped ticking over for the minute and it's 12 o'clock. So we'll make a start. There may be a few more people joining us later, and this session will be recorded and will be available on our website for people to watch at a later date if they're not able to join us live. So kia ora everybody, my name's Jane Morfitt. I'm the COVID Clinical Education Manager with the Immunisation Advisory Service, and it's my pleasure today to host this joint webinar with my colleague Donna Keeler from the Ministry of Health. So we're going to be looking at COVID-19 vaccinators working under supervision, the new course that we've developed in partnership with the Ministry. This is the second of two webinars that we're presenting. We presented one last week as well, so people have already had some opportunities to ask questions and engage with us. So I'm delighted to have Donna Keeler, who's the workforce lead for the COVID-19 vaccination and immunisation programme with the Ministry of Health, who will set the scene about this new role to start with. Donna, it's great to have you with us, and it's lovely to have somebody from the Ministry of Health who's also got a background in Maori Health and in nursing as a registered nurse. And it's been great to work with you as we've developed this programme alongside my colleagues, Catherine Tobin and Amy Brass, who have been involved in the training and the development of this course right from the beginning. So we're going to start with Donna, and then we'll move on to Catherine to talk about the actual training process, and then Amy will be joining me in helping to respond to questions. If you do have questions, at the bottom of the screen you'll see there's a Q&A button. Please can you type your questions in there? We'll either answer them individually, or most of them we will answer live. Some may be covered in the presentation as we go through, but any that are left that we haven't covered at the end of the session, we'll have an opportunity to answer them. We won't be using the chat function, so we've disabled that for this presentation. And as I said before, the webinar will be available to watch at a later date. Also on our website under written resources, we have a reflection template that you can download, fill in the details of the webinar that you've listened to, put some reflection in there, and then that can be part of your professional development portfolio. So with no further ado, I'll hand over to Donna. Thank you, Donna.
Kia ora tātou. So yeah, thank you, Jane, for the lovely introduction. As she referred, my name's Donna Keeler. I am here at the Ministry and been working alongside IMAC and to enable a new workforce. So I'm going to share some slides. And you guys are about to see how technically, here we go. Cool. Hopefully you guys can see that in presentation mode. So we want to provide a bit of an overview of the journey that we've taken so far to get to this place where we've enabled a new workforce to work alongside existing workforces. So when we started this journey, we were faced with the biggest immunisation program that New Zealand has ever seen. We therefore needed to make sure that our workforce was ready to go in terms of not just the training available, but in terms of scale up to meet the demand. We also are very aware that we need to ensure that we have a workforce that's reflective of the communities in which we serve. So this would be, you know, not just ethnically, but linguistically as well. We wanted to be able to build on workforce with existing trusted relationships within the community. So the aim, of course, is to increase our Māori and Pacific representation in our workforce. We also know that there are other important vaccination programs out there, and we wanted to allow for the initial workforce to be able to go back and continue on that important work as well, including childhood IMS. And we also saw this as an opportunity to create a legacy. So in terms of the steps that we've taken, we looked at scoping our existing workforce. We have some phenomenal vaccinators out there, potential people who it is within their scope to vaccinate. We looked at what was happening internationally. So if we look at the UK, for example, they have enabled non-healthcare professionals to be able to administer the COVID-19 vaccine. We looked at some of their approaches. We also provided an opportunity for consultation as well, and that's internally within the ministry and externally across various health professions. I don't know what the numbers were, but we received quite a number of submissions on that, and we took those into consideration as well. We then needed to make some amendments to the medicine regulations, which is the regulation that outlines who and how we can authorise health professionals to be able to vaccinate. So we've got an additional 44AB there that talks about this new workforce of the COVID-19 vaccinators who work under supervision. And then the exciting thing one of the exciting things was working alongside IMAC and also Career Force to create a fit for purpose training program. So this was to ensure that, we met the requirements according to regulations, that it was tailored to meet the target audience, and that it was going to result in creating a confident and competent workforce to work alongside existing workforces. We also piloted, and then we evaluated, and then we piloted, and then we continue to evaluate. And when we've got this workforce authorised and actually in the workforce, we will continue to evaluate. So when I talk about the training to meet regulations, particularly, again, this was the Medicines Regulations 1984, we have a reg that's 44AB, and the training needed to obviously cover the administration and the safe handling of immunisation products, so the administration of the COVID-19 vaccine, sorry. And it also needed to include basic emergency techniques, including resus and the treatment of anaphylaxis. So within this training program, IMAC lead in terms of the management and the treatment of anaphylaxis, and we require this particular workforce to have a basic CPR certificate, noting that they won't be leading in emergency situations, but they will be able to be an extra support person, be able to recognise when to escalate and get more help. So it's good to sort of highlight that authorisation is granted by a National Medical Officer of Health. So the standards are the same in terms of they still need to provide the evidence, documentation, and then this is granted and authorised by a National Medical Officer of Health. So the people that we're looking for to be able to fulfill this new role is people who particularly have an experience working in healthcare. And this is to, again, work with existing skills that are valuable within the program and add on to that, utilising the relationships and the trusts within their communities that they have existing and providing them with a new skill set. Again, so people who want to broaden their health skill sets, People who may have expired APCs where beyond what their regulatory body may provide an interim certificate. Also wanting to capture those who are potentially internationally trained and who don't currently have an APC here in New Zealand. Maybe they're in the process of doing the bridging. And again, when we reflect on needing a workforce that is reflective of the community that we serve, we want more Māori and Pacific to be able to engage in this particular workforce. So when we talk about the responsibility of a COVID-19 vaccinator working under supervision, it is their responsibility to administer the COVID-19 vaccine only, and that's to pre-assess and pre-consented health consumers. And when we talk about that, we are referring to the fact that a healthcare professional needs to assess the health consumer for vaccine readiness and to obtain the informed consent in preparation for them to have the vaccine with the COVID-19 vaccinator working under supervision. We wanted to acknowledge that in this instance, the obtaining informed consent and also completing the pre-vaccine assessment, it requires quite a high level of experience as a healthcare professional and skill. So that's why we haven't included that in the scope of a COVID-19 vaccinator working under supervision. They can participate in post-vaccine observation. We are training them to be able to answer COVID-19, basic COVID-19 vaccine questions, and particularly be able to recognise any adverse events and support in emergency management. And of course, it's their responsibility to work within the regulations of which they've been authorised under, and to work within the limits of their sort of competence in their training. They will always be following the direction of their clinical supervisor, which we'll talk about soon. And as per any employee, they're to adhere to the terms of the employment contract and any frameworks that may be in place. So as a nurse, I'm pretty excited about this new role. I think that in terms of the clinical supervisor, these people are really important in ensuring that the new role is successful. In terms of their role, the clinical supervisor role, they are people who are either an authorised vaccinator, maybe a prescriber or a pharmacist vaccinator, who has at least 2 years vaccine and immunisation healthcare experience. What we're wanting to capture in this particular role is someone who is, got that level of experience to be able to provide support and guidance to this new workforce. So when we talk about ratios, we're thinking it will be up to 6, supervising up to 6 COVID-19 vaccinators working under supervision. This ratio has been tested and is successful internationally. And of course, if you're new in the COVID-19 in the clinical supervisor role, particularly for this workforce, you may want to start at a ratio of 1 to 2, just while you're getting an understanding of the new role, getting an understanding of what your role is as a clinical supervisor, and but certainly up to 6. Other things are to provide professional clinical advice to the health consumer. So again, we are training the new workforce to be able to answer basic questions, but there might be curly ones, and you'll be there to provide support in that space. It is really important that the clinical supervisor is immediately available for reasonable access. So whilst when we talk about supervision, it might be direct, as in you may be in the room directly with the COVID-19 vaccinator working under supervision, or you may be on site somewhere and there's a mechanism in place for you to be available as soon as possible if needed. And of course, coordinating with other leaders that might be on site if need be. In terms of responsibilities, so you'll be responsible for providing direction and guidance to the COVID-19 vaccinator working under supervision. You know, you want to ensure that the new workforce maintain competence, that they are performing their tasks they've been authorised to do. And again, highlighting involved supervisors must be immediately available for reasonable access if needed. When we talk about, so we've talked about responsibility of the COVID-19 vaccinator working under supervision. We've talked about the responsibility of the COVID-19 clinical supervisor. And now we talk about the employer's accountability. So they are ultimately accountable for service delivery, quality and safety. So it's important that they you know, they're accountable to ensure that their workforce is appropriately trained and resourced, and that their workforce reflects the community. And they are accountable to ensure that there are processes in place to identify and respond to and learn from adverse events. So that's ensuring that things like there's frameworks, there's processes in place that the workforce can follow if there are any adverse events. Oopsie, here we go. In terms of protection and safety, we have ACC who will be covering in terms of if there's an event of an injury. This will be covered by ACC. In terms of the employer, they're going to again have processes in place to identify and manage any events that any adverse events, and they will also be having robust systems in place to ensure the safety of the healthcare consumer. The COVID-19 vaccinator and indemnity, so it's expected that employers also ensure that they have access to indemnity insurance. In terms of the clinical supervisor, the majority of clinical supervisors will already have indemnity insurance, but you just need to ensure that you're comfortable with the level that you have in terms of indemnity insurance. Cool, so I will, I'll stop sharing and hand it over to the next.
Thank you, Donna.
We'll have some questions at the end, so I'll pass over to Catherine. I'd like you to share your screen.
Yeah, thank you. Kia ora koutou. My name is Catherine Tobin, and I am an immunisation education facilitator for the Midlands region. I'm just going to share my screen with you here now. So I'm going to talk to you today about the COVID-19 vaccinator working under supervision training pathway. So as Jane mentioned, myself and Amy were heavily involved in creating the education material and in piloting it. So we've had some great experiences out there in the community, and we just love to share with you what we do throughout the training pathway. So it is broken down into 3 phases. So first of all, once I am an employer of a COVID vaccination site, which is DHB commissioned, confirms that they've got some suitable candidates and candidates who are willing and interested in becoming a COVID vaccinator, they then get in touch with the regional immunisation advisor for that area, so be it Waikato or Auckland or Central, and they then get they put forward the names to IMAC, who then give a individual unique code to access the e-learning module specific to each person who will be doing it. So there's no sharing of codes, it's really specific to that one person. So they go on to the IMAC learning platform, complete the e-learning module, Usually takes about 3 to 4 hours, and a pass rate of 85% is required for the written assessment, but you get 3 attempts to pass it. They will then need to complete the CIR module as well, so they'll be able to use CIR and enter the information in under their own name. And they also need to complete a CPR or a first training program as well. The second phase is the face-to-face practical workshop. Okay, so this again is arranged through the regional immunization advisor. All people attending the practical workshop will need to have completed the e-learning module and have downloaded their certificate as proof of that before they attend the practical workshop, because we draw down on a lot of that information from the e-learning module on the day that we deliver the practical. So it really makes sense to have it completed firsthand. So on that workshop, we really focus a lot on technique. We focus on safety, understanding their role and their scope, and when we really focus on safety and when they need to ask for help and what support they should have in their situations. We really encourage the supervisors or the people who will be doing their supervision to attend these sessions if possible. And the reason being is that this is so brand new, they need to gain an understanding of what's involved in the role, what we're teaching them. And we also will go through the workbook with them and the peer assessment form, so they have a really great understanding of what's required of them and how to perform the peer assessment, which is really important. So once we're satisfied that each candidate has completed the practical session and took part in it and in all the activities that we do, we then give them the workbook. So the workbook is viewed as a passport onto the next section of the training. It is signed by both us as the educators, and the candidate signs it as well. And throughout the workbook, it's a continued learning resource. So there's some hints and tips and advice written in it. It is a place to document that they've observed the reception area, they've observed vaccination area, they've observed seeing the vaccine being drawn up. So it is really like a module to bring with them throughout their process. The third phase then is employer-led. Okay, so this means that this is where the supervisor really comes into play. The employer has responsibility to provide a suitably trained supervisor to support these vaccinators. Things to keep in mind would be the experience of that supervisor within the vaccination scope. Experience in supporting and assessing individuals, what are their teaching skills like, and their availability to the COVID-19 vaccinator throughout their phase where they're learning to vaccinate and afterwards as well. So Donna touched on the fact that the 1:6 ratio, and this applies really after the COVID vaccinator has been authorized. We would suggest that during the assessment stage and the learning stage, that ratio should really be 1:1 or 1:2. It would be very hard for one supervisor to have 6 vaccination candidates and 1 patient and trying to teach them all how to do it 1 patient. It wouldn't be very nice for the patient either. When I say patient, I mean consumer coming for their vaccination. So really, the 1:6 applies as a maximum once the COVID vaccinator has been authorized. The peer assessment needs to be done by an authorized vaccinator with at least 2 years experience. The peer assessment is very important, and we advise people to take it quite seriously. And the same as a peer assessment for a provisional authorized vaccinator or for a independent vaccinator as well. Once the person has been authorized, that person supervising, could be someone with less than 2 years once they have been signed off appropriately. It's like I compare it to building a house. If you lay the foundation correctly with the excellent experience and advice and shown how to do things really well, everything else will flow on and be built correctly upon that. Whoever's going to be working with them on a day-to-day basis needs to be involved from the very beginning as well and make sure that they're aware of what the role of the COVID vaccinator working under supervision is, what is their limitations especially. So once the workbook is completed, So they, as I said, they spend time in each vaccination or in each area in the COVID vaccine clinic, observing what goes on. And it's really important, we find, that the COVID vaccinator working under supervision understands everyone else's role in the vaccine clinic as well. No one is an island, so they really need to understand what everyone does and where they fit in the team. It's very much a team environment. They complete at least 5 supervised vaccinations under the guidance of their supervisor. This is after they have watched and observed the supervisor giving vaccines. They then have to complete 5 being supervised, at least 5. They can be more than 5 if they want. For these 5 supervised vaccinations, the employer will need to use a standing order or a prescription. Standing order will probably be easier rather than trying to get an individual prescription for 5 people. So yet the employer will need to have a standing order in place for that. Once the documentation is completed, it is sent to the Ministry of Health. They cannot immunize until they get confirmation received that they've received their authorization. So the practical session. When we come along to each area to perform a practical session, we put aside 3 to 4 hours, depending on the numbers we have. And we also, keep in mind that we change our teaching techniques and our ways we communicate based on who we have in front of us, what their experience is. So we're quite flexible in that respect. It's a really hands-on practical session, lots of opportunities to practice, to ask questions. It's a very safe learning environment. So no one needs to feel uncomfortable attending or unsure of themselves. We're there to support and to learn and have a bit of fun along the way. So things we focus on for practical wise, we get them familiar with needles and syringes, what it's like to hold a needle safely. We talk about the basic facts about the vaccine and being able to communicate them confidently to people. We ask them to be familiar with the documentation associated with vaccines. So we look at all the Ministry of Health resources and we have some copies with us. Now we look at the consent form in great detail, and the reason being that the consent form, the paper copy, needs to be used in any site who will be using COVID vaccinators working under supervision. The reason being, on the back page of the consent form, the top panel, this section is used as the communication between the vaccinator who takes the informed consent and screening questions and the COVID vaccinator working under supervision. So they will write on the back of it if there was any positive answers to any screening questions, yes or no. Has informed consent been gained, yes or no? And they will do their signature at the back. So that is the communication panel between the authorized vaccinator who did the screening, took the consent, and the COVID vaccinator working under supervision. It's a means of communication. So this at the moment cannot be recorded on CIOR. So therefore, this paper consent needs to be kept and stored like any other piece of medical information. Because if down the line there was some question about what happened, they can go back, look at that piece of paper and say, yes, well, we know that Mary did the informed consent and the screening questions, and we know here that Joe gave the vaccine. So that's the reason that we need to use the paper consent forms. So we obviously cover how to give the vaccine, injections, and we have injection trainer arms, and we give lots of opportunities to practice, focusing on infection control, safe sharps disposal, mitigating any pain when giving injection, how to have conversations with people who may be a little bit nervous and things like that. Now, we also cover understanding anaphylaxis and other adverse events that can occur following vaccination. Whilst the COVID vaccinator working under supervision will not be administering adrenaline, we do go into depth about why adrenaline is used. We cover anaphylaxis and the important role of adrenaline in such an event. We cover extensively what the role of the COVID vaccinator working under supervision is if such an event were to occur. So we cover things like being familiar with where the emergency equipment is kept, what it looks like, what adrenaline looks like, checking the date, checking the anaphylaxis kit that it's well stocked and with appropriate items. If you really need to ring the ambulance service, what kind of information will they require from you? What kind of things would you might need to document while the other individuals involved in the anaphylaxis might be administering the adrenaline? So all those sorts of things are covered. We also talk about other common things that can happen after vaccinations, such as fainting, maybe a hyperventilation episode, and what to do in those events as well. So that's all covered in this section. So some of the key messages for the practical component, we always start off with asking everyone to introduce themselves and talk about the reasons why they've come on the course. And we've had some really insightful answers, and it's made us very aware of how actually there's such a need for this course and this qualification to be granted, because there's so many people out there with so many valid reasons for wanting to help. And wanting to further their own education and skills and see where that takes them. So we find that really quite an emotional experience, actually very privileged to be part of that. We encourage people to ask questions. We used to say at the very beginning, you know, there's no such thing as a stupid question. Ask away, we're here to help. Now is the time to ask. And we always draw down on some real life experiences as examples when we try to answer those things. And the practical session, it also involves a lot of role play, so we can cover those types of things then. Our big focus on the practical session is, if unsure, ask for help from your supervisor or from any experienced authorized vaccinator. That, you know, don't go guessing. You know, it's too late if an error then occurs. Always put your hand up, say, supervisor, I need some help over here. So we remind participants of their scope as well. So that's really important from a safety point of view. They are aware that they are not able to take informed consent. And so that's really important, and that the health screening questions for the suitability of that consumer to have the vaccine is not done by them either. They will ask some questions prior to putting the needle in the arm, just to make sure that all those steps have been covered. As I said, we discussed the different types of emergencies as well that can occur. And then by having the supervisor present to help the participant gain understanding of their role. So by having the supervisor present, you know, you cut down on that time after the session where there might be some miscommunication because someone wasn't sure whether they were supposed to be doing that or not. And so having the supervisor present just makes so much sense. And then, yeah, we can cover, at the end, we cover with the use of the workbook. Inside the workbook, there's a really great page on what is the role and responsibility of the COVID-19 vaccinator working under supervision, and also of their supervisor. You know, so it's really clear and black and white what's expected. So ongoing support. As I said, we really, you know, work closely with the supervisors. And we would encourage, you know, that, and if you have any group of people who are working together with this new candidates for delivering the COVID-19 vaccine, that they come together frequently just to talk about how it's rolling out in their situation, you know, celebrating their successes, but all, you know, always as well focusing on, you know, are we slipping up anywhere? Is there any extra support we need to put in? Is there anything we can improve on? Am I unclear about anything? And of course, IMAC staff are always on hand to answer any of those questions, or to come back in, give more support. That's absolutely fine. Especially with supervisors who may not have done a peer assessment before, we can certainly come in and sit with them to give them some guidance on how to perform that peer assessment. So continuing to reflect and learn, like anything in every situation that us as healthcare professionals come across every day, that we need to reflect and learn from what we do. The workbook is a document of progression. As I said, it documents their progression towards being authorized. It's the assessment form is in there as well. And as I said, there's some educational resources there also. Everything about COVID changes very rapidly. COVID-19 vaccine changes very rapidly, as we know. Information is changing frequently. So we would encourage everyone to subscribe to the IMAC newsletter, have regular team meetings and WHOIs, just to keep up to date to make sure that practice is continuing to be safe. one other thing I wanted to mention was that the reason IMAC provide the face-to-face education and practical session is because we want it to be uniform throughout the country. We did have some queries of saying, you know, we're an organization, we have experienced authorized vaccinators, you know, who've been vaccinating for years, can they not perform the face-to-face session? And we as an organization, as IMAC, we work alongside the Ministry of Health to provide this education. We've been contracted to provide this education so that we can keep it uniform throughout the country. We know it's at a certain level, and it, you know, these people will eventually go on to gain an NZQA standard. So we have some obligations to provide it at a certain standard as well. So that's kind of the reason why we come in to do that. Yeah, so this is a lovely picture of some candidates from Turanga Health and Gisborne. Lots of smiling faces. This was at the end of the practical session, and there were a great bunch of people. And you know, the majority of them now have been authorized. They've received their authorization, and they're happily vaccinating. So I think that is just proof that this education works, and given the right support, it can be very successful. And I think it's watch this space is going to be ever developing as we progress with our COVID-19 vaccination rollout. And that's, I think, everything from me. So I'll just stop sharing.
So kia ora. Thank you for that, Catherine. I think that went very nicely, nice and clear as to the training that's involved. So now it's an opportunity for us all to respond to some of the questions that have been coming in. Oh, and welcome, Melissa. I saw your name come up on the screen. Another person joining us from the ministry, and Diane Alexander's joining us as well, although I can't see her picture at the minute. But so we have a panel of people to respond to some of these questions that have come in. So I thought if we started off with some questions around the supervisor's role and the idea, firstly, people wanting to become COVID vaccinators working under supervision, which is, I think, a great start. We've had a few people asking questions about whether there are any plans to have a register for employers looking for staff to work in this particular role. And I think at the
Yeah, that's a really good question. So we have a database now called the Hands Up database, which is on the Ministry of Health website. So you're actually able to go on there, register your interest, indicate that you're interested in becoming a COVID-19 vaccinator working under supervision. The great thing about that database is that DHBs and other employers have access and are able to kind of pick up if they're needing to fill that workforce particularly. So yes, there is, and it's live and it's being reviewed. So yeah, if you are absolutely interested, just go to the Hands Up database.
Thank you. Right, so then looking at the role of the supervisors, there's been a couple of questions come through, so I'm just sort of trying to put them into a logical order. Firstly, the delegation of responsibility. If somebody's taking on the role of a supervisor, there's some concerns expressed that should I be watching somebody on a one-to-one basis all the time? Because if they do something wrong, will it be my registration that's on the line? So I think it'd be quite helpful to just talk through the scope of practice of obviously setting up a safe environment for them to work in, but also then reminding people around the indemnity ACC type provision.
Yeah, and it's a really valid question and great question. So Mel or Melissa and I are going to sort of tag team this one. What I will say is that some of the things we have in place to ensure that everyone is working safely is that the clinical supervisor needs to have a level of experience of a supervisor. So when we're not looking at newbies in healthcare or in their profession, we're looking at people who have a level of critical thinking and decision making, particularly in this role. And I'll let Mal kind of Sorry, Mel, to chuck you in.
No worries. Kia ora koutou. Yeah, I think that's absolutely right. As Donna said, there's employer-led systems and processes in place through all levels of a vaccination site to ensure that patients are safe and that employees are safe as well and operating safely. And everyone at every level, so the supervisor, the COVID-19 vaccinators working under supervision, everyone has a personal responsibility, professional responsibility to be working within the scope of their own role. So I think that's part of the question. And so the training that our IMAC team has been talking to and absolutely talks to those COVID-19 vaccinators working under supervision about the scope of their role and where it stops and finishes. Sorry, just one moment. Can you just mute your yeah, so absolutely. So everyone has a responsibility to just be performing within the scope of their role. You'll have seen earlier in the presentation, Donna spoke to the recommendations. We talked about ACC. So as long as people are working with as expected, so those supervisory ratios are in place, that COVID-19 vaccinators are working under the direct guidance and supervision of a supervisor, direction and guidance of a supervisor. As long as those criteria are being met, then if anything should happen to an individual, if there's an injury, then those people are covered under ACC treatment injury provisions, assuming everyone is doing as they're meant to be doing on site. And that's also to give the extra assurance. That's why there is that recommendation that people have either through themselves or through their employer, perhaps their union, have ensured that they've got a level of indemnity insurance that they're comfortable with for when performing their roles. Because, yeah, we absolutely appreciate that there is a certain degree of newness to the to this particular role, but as I understand it, there are lots of examples across the sector where we can draw some parallels in terms of, for example, relationship between a supervisor and healthcare assistant, so kaiawhina in schools, healthcare assistants working in aged care or in mental health roles as well. So there are some precedents in the sector where this is maybe not entirely new, but yeah, where we can get draw some confidence from. Yeah.
Okay, thank you. And so just a couple of other questions around that supervisor role before we move on. So questions come up around, do supervisors need to have formal assessment qualifications? So I'm happy to talk to that one if you like.
Yeah, go for that, Jane.
Well, if you're actually doing the assessment, the final sign off of the vaccinations, the 5 vaccinations, minimum of 5 vaccinations, we are very keen that that person is an experienced vaccinator, 2 years experience, authorised vaccinator. But the standard for sign off there is exactly the same as it would be for any other healthcare professional that's becoming a provisional vaccinator and being signed off by a colleague or a clinical assessor. So that level is staying the same across the board for everybody. When it comes to supervisors, it may be once the students are up and running and super confident and know what the students, the COVID vaccinators that are working under supervision, know what they're doing, you may need the supervisors to have slightly less experience. If they're confident in giving COVID vaccines, lots of experience in that field, maybe not the 2 years experience. So as Donna was talking about, the levels will change, but that sign off, no, they don't have to be a clinical assessor as such. Great if they've got a background in assessing and teaching, because obviously there's a lot of coaching and encouraging and getting them up to that really good confidence skill level to start with before they sign them off. But you don't have to have a formal qualification, just experience in vaccinating there. And I'd also like to add just personal experience. Actually, I've been training healthcare support workers in the UK since 2009. And it's been fantastically successful. These group of staff are really enthusiastic, but they're also, once they've gone through a formal training process, very good at following rules. We had I can't think of any instances where we had the sort of things that people are worrying about. What if they stick the needle in the wrong place? What if something goes wrong? Actually, they were remarkably good. I had more errors coming up from the regulated workforce, well, they're regulated anyway, but the qualified staff than I did from this workforce, because the supervisors were there, they were supervising, the quality assurance was there throughout the program, people regularly keeping an eye on, you know, make sure you're not going too low with your vaccines or too high or whatever. The standard was maintained throughout. So, you know, it was a process that worked really well and has been working for many years. So I've got lots of confidence in this program. And I think some of these concerns are just because people have not tried it. And there was one other question around supervisors. Is it feasible to have different supervisors for these students?
So to clarify, is this in the training mode?
I think that's what I was hoping you would point out. Yeah, the idea of having some continuity when you're starting, but equally being more pragmatic if you're running a bigger session.
So in training mode, the recommendation would be to have one supervisor who is responsible just so that they can kind of see them from the beginning and support them to the end. In terms of in practice, we couldn't put that as sort of standards up that you have one supervisor. In a large vaccination site, for example, or actually on any site, you know, the clinical supervisor needs to go on a break. So they may, for a period of time, have another supervisor. So in training mode, recommended just for those who have sort of training and education experience, the consistency in being able to work alongside that trainee is really important in their development and in practice, and once they're authorised to then, as long as those frameworks are in place, then yeah.
Okay, that sounds good. And then just the other question that sort of leads in from that is, how would this work in different environments? Because I think we've sort of visualised it more in a mass vaccine type setting, but how could we maybe be flexible with it?
Oh, great question. And though when you hear about the scope of a COVID-19 vaccinator working under supervision, it may lean itself to larger sites. Definitely we've been working with larger DHBs and how we can tailor it, but we've also been working really closely with Māori providers who more often than not have smaller sites, and they may be in a marae setting, for example, where this works so well. As I referred to before, we wanted to work with existing relationships. So some workforces have amazing community trust relationships, and we're wanting to build that and upskill and be able to utilize that. It depends on, I guess, what the employer is needing in terms of their workforce. So if they need to prioritise diversity within their workforce or a particular skill set, then they will make this role work for any which way. Some smaller pharmacy sites are wanting to use this with their pharmacy technicians, but definitely in the larger sites, it will work really well. Yeah.
Okay, thank you. There's a question here which I think I will answer about standing orders. As was mentioned, when this workforce, as with anybody that's giving a vaccine that's not already authorised, whether you're a healthcare professional or not, you do need a standing order. The standing order does need to be signed by somebody working in that environment. So it needs to be from that employer. We have a template, so we're very happy to share that with the supervisors when we put the students through their face-to-face training, but it will actually need to be adopted by that particular employer, and obviously you'll need to get a prescriber to sign to take the responsibility for it. But we've put all the sort of background words together, so that shouldn't be too onerous. Right, have I missed any, Catherine?
I think there's just questions coming in about the necessity to have employment prior to being put forward on this course. So employment is required, and the reason being is that you need that set up after we deliver the education to be able to have the opportunity to observe and be supervised in the place that you're going to be working in. So it just makes sense to have the employment prior to starting the education.
Yeah, just to kind of support Catherine, Catherine's kōrero, part of the training is that supervised sort of practice prior to being authorised, and so the setting needs to be a setting that supports their learning. And so the other thing is that we didn't want to have too much of a gap between when you do your online component to when you put that into practice in terms of the practical session, and then going off to be supervised on site. So there was a lot of thought that had gone into, it's not that we want to set up barriers, it's that we want to be sure that they're supported throughout the training and it's succinct as well.
Okay. Any other questions? I'm just typing a response as I'm getting distracted here. I've had somebody asking me about the training pathway for an authorised vaccinator who has got an APC. So that's obviously different. So hence I won't answer that I won't ask that question on this one. I'll just respond to that one in writing. If anyone's got any other questions, any questions that we haven't answered, please, now's your opportunity to type them into the Q&As.
So Donna, this one might be for you. Kelly's asking, can you clarify how to get access to the Hands Up database as an employer?
Oh, as an employer, cool. So at the moment we have, actually Di probably can answer this one, but she's like Hands Up guru. As an employer, so the DHBs have access to the Hands Up database. If you're a smaller provider, for example, get in touch with the workforce leads within your DHB, and they will be able to support, because I know that a lot of the providers are looking for particular workforce, and there are people that are registering across the country. So if you're not directly in the employed by the DHB and you're a provider employer, just get in touch with your workforce leads at the DHB, or email Di to hook you up with those people if you don't know who they are. Oh, there we are. Here's Di. And the question above, I think we did answer by around the level of experience of the clinical supervisor. So yeah.
Yep, I think it's looking like we've answered,
that one. Yeah.
Yeah, I think we've answered
Cool.
pretty much all of them. So if anyone thinks there's a question we haven't answered, there's your last chance to type it in now.
And I just add, sorry, something I forgot to mention, that the paperwork, once the workbook is completed with the peer assessment form, which has been signed by the supervisor who performed the peer assessment, there's also going to be on the back of the workbook an application form to complete, to send to the ministry with all your paperwork, and it's all made very clear in the workbook what paperwork is required. That needs to be completed as well, the application form for authorization and sent to the ministry. Now, this is a new step. Previous to now, it was IMAC who were receiving the applications. So anyone who's already received this course, perhaps who's on here, or if you're talking to someone who's already done the course and is in the process of completing their workbook, we will be getting in touch with them and sending them the correct application form to send their authorization.
Okay, so one last question come in. Could a provisional vaccinator be a supervisor, a clinical supervisor?
Tricky. So again, I want to refer to the level of experience that we need from a clinical supervisor. So we want them to be able to have, around 2 years experience in immunisation and vaccination healthcare delivery, or someone who has a lot of experience managing emergency situations. So there's to give them a title is quite difficult. Obviously, when we talk about what that means, it lends itself to an authorised vaccinator because they are more likely to meet those criteria. Remembering that provisional vaccinators haven't been around for 2 years. Correct me if I'm wrong, Jane.
Yeah, that's true.
But we wanted to be able to capture people who, for example, have maybe been authorised vaccinators and had heaps of experience in the past, maybe let them lapse and decided that they just wanted to administer the COVID-19 vaccine as provisional vaccinators. So whilst we can't say no or yes, we want to be clear that it is the employer's responsibility to ensure that the right person with the right experience, with the right level of critical thinking is fulfilling that clinical supervisor role. Cool.
Thank you, Donna. I think that's a nice one to end on. And I think it's just remains for me to say thank you very much to everybody for joining us. Remind the audience that if you do want to download the reflection form from our website, I've put a link in the chat to our website, immune.org.nz, and then link through to the COVID section. You can reflect on the webinar and then have it as part of your professional development, and it will be available online for people to listen to. So thank you all very much for participating, and thank you for joining us. And I wish you all a good afternoon.
Kia ora.
Kia ora.
Kia ora.